Good morning. I'm going to do an ABG. So the first thing I'm going to do is check the patient's chart and look for the doctor's order, and then I am going to check to see if the patient is on anticoagulants or anything that could cause them to bleed longer than normal. So the first thing I'm going to do when I walk in the door, I'm going to knock on the door, introduce myself, wash my hands, check the patient ID band, and then I'm going to assess the patient, check their vital signs and everything like that. Then I'll position them and get them ready for the ABG, and I'll explain to them what I'm going to be doing. So today I'm going to do an ABG, which is an arterial blood gas draw, and this comes from your artery it's different than any other blood draws. It's going to be a little more sharp pinch than you're used to, just because it's coming from the artery. And so I need to instruct them to be as calmly as they can, to look away if they're scared of the needle, and not to worry about anything, and I will do it as quickly as possible. And so when I'm ready, I will apply on my PPE. I'd apply on my gloves. And if I need anything, if I feel like I want to put a mask on just in case for any splashing, but there shouldn't be any problem with that. So when I'm ready, I'll do a modified Allen's test. So you're going to occlude the ulnar and radial artery, and you're going to have them do a fist 3 times like this, and when they open up, you're going to watch the flushing of the palm to see if it comes back within 5 seconds or so. And if it comes back negative and it's not a very quick flow back, then we'll check the other arm. And so we always try to do it on the non-dominant arm. So say this is their non-dominant arm, so we're going to palpate the pulse when we're ready. Make sure we feel it, make sure it's a good pulse. We can find it. We'll get our needle ready. We'll remove the cap, and we will hold it like a pencil. Make sure the bevel is facing up when we go in. We'll palpate again just to make sure we got it, and we'll go right near it, and we will stick in, and then we should begin to see flow into the needle here, up into the needle. And we will take our gauze when we are done. If it's all full, we'll carefully remove the needle, make sure not to poke ourselves when we're doing it. Then we'll take the needle and poke it into the stopper, and we would dispose of it. So when we are done, suggesting that we are done, have disposed of the needle, we would make sure it's removed and in the sharps container, and we would put on a safety cap here, and to make sure there's no blood clots or anything, you can roll it to make sure it's all mixed up together. And then when you're ready, you'll set it into the biohazard bag. And then you would place a label on there, and so the label would have the patient's name, the room number, the test that you're doing. So you'd put an ABG test, ventilation. You would put if they're on room air, 21%, or if they're on an oxygen device, then you would put it at whatever FiO2 that device is set at, and not put the flow. And so you'd send this immediately to the lab, but if you can't get this immediately to the lab, then you'd set it on ice. But assume that the patient is done bleeding and everything is stopped bleeding. You may have to hold them longer than 10 minutes if they're on an anticoagulant, but you would place on a Band-Aid over the wound site, and you'd instruct them to leave it on for at least 4 hours, so that way you don't get any infection, anything like that, especially drawing from the artery. So when we are done, we will make sure everything is cleaned off, make sure we have cleaned off everything, and always, before you always do ABG, I did mention you always have to do an alcohol prep wipe on the wound site before you poke them, okay? Before you poke them or anything, and make sure it's clean. So when everything is done, I would remove the PPE, reposition the patient, make sure they're set okay. I wash my hands, I would reassess them, check their vital signs, everything, and then I would go out and I would chart on the patient's charts and let the doctor know that I did the ABG, and so that way he can look out for that and check them.